Hi, everyone, and thanks for joining our first keynote speaker. This is session K1, and Bonnie will be speaking on the 3 R's: reliable, rigorous, and robust. I wanted to let you all know that this is being recorded. So I will give a brief introduction of Bonnie, and then she can take it away from us. So Bonnie is a senior statistician at RAND working in public policy. She also leads the RAND statistics group. Her experience includes being lead statistician for large-scale surveys on sexual assault and harassment in the U.S. military, as well as for the first Singapore mental health survey to assess national prevalence. Her current collaborations center on multiple National Institute of Health studies, leveraging quasi-experimental design to evaluate the effect of neighborhood-level change on residents' diet, sleep, and cardiovascular health. She is a fellow of the ASA and has been recognized for her collaboration, leadership, and mentoring. She was recently honored by the Penn State Eberly College of Science with the 2025 Outstanding Science Alumni Award. She is the 119th president of the American Statistical Association, and I feel lucky to call her as a friend.
Gosh, thank you, Jessica. That's a beautiful bio. And I was quite touched by that speech session by Maritza and reminded that this is a community, a very supportive community. And we each have our unique journey, challenges, and successes, and we're here to celebrate it. So thank you again for organizing this event. I think I'll switch over, Jessica, to sharing my set of slides now then.
Sorry about that. It should be good for you.
Yeah, does that look okay to you?
Yes, perfect.
So thank you. Thanks for the introduction. Thanks for your time and attention today. I may not be able to moderate the chat, but as we go along and towards the end, I do think we'll have a few minutes for a little Q&A. If you have a question, a burning question, just feel free to drop it in the chat. And I know that Jessica, who's a good friend, will moderate that for me. So good morning, good afternoon, good evening, wherever you are. Welcome to all participants to this wonderful event, which is the International Day of Women in Statistics and Data Science. I am so proud to be part of this supportive community and to celebrate all of your successes. I'm happy to have this opportunity to talk about statistics and data science and the application of that to create and have impact in the world and in society. It is an immense honor to be here today delivering a keynote. It is something I do not take lightly. So the topic of my talk, the 3 R's, reliable, rigorous, and robust, reflects my perspective as a collaborative statistician in public health and health services research at RAND. RAND is a nonpartisan institution that helps improve policy and decision-making through research and analysis. In addition, it also reflects, that is, this talk reflects the vision of the ASA, which includes a world that relies on data and statistical thinking to drive discovery and inform decisions. I am the head of the statistics group at RAND. I also have the distinct honor of serving as the 119th president of the ASA. So the basic premise of my talk is this. Let's see if I can guess. Thriving in my professional environment, thriving in our professional environment, I believe requires us to use these guiding principles in each of our scientific fields and in my work in public policy research. Reliable, rigorous, and robust. We are, as statisticians and data scientists, we are viewed as reliable partners in team science. We bring rigor through a variety of methods and tools, and we strive hard every day to ensure that findings are robust. I'll try to touch upon these guiding principles as I implement them in my work in public policy, and here is an overview of my talk. I'll talk first about both challenges and factors that help me in my journey to get to this field that is public policy. I will then explain why statistics, and when I say statistics, feel free to think of it as data science because I think I am a data scientist, although my title is a statistician. But I want to explain why statistics, I believe, is essential for sound science, and especially in public policy, but actually in every application area. And how doing that means that statisticians go beyond their traditional domain of data and analysis to become true collaborators in a research undertaking. And I will illustrate that essential relationship by describing an important case study from Rand Health, paying particular attention to the study design and the role statisticians played as collaborators in these projects. And finally, I will close with a few remarks about thriving in our environment and a call to action. So first, I'd like to talk about my journey to public policy and some challenges and some factors that enabled me to be in the spot that I am today. My family moved to Kolkata, India from Borishal, which is now Bangladesh, where I was born. And throughout my childhood, my parents' encouragement to dream big, along with stories of philanthropy by my ancestors, influenced my dreams and aspirations. After high school, I was really fortunate to receive a foreign student scholarship to be able to come to the US to study computer science, and this altered the course of my life and career trajectory. After completing a bachelor's in computer science and mathematics, I found myself drawn to collaborative research, and I think it was not only a function of my interest and skill set, but it was also a matter of personality where I found myself to be highly social and doing well in collaborations. I looked across a range of departments. I ended up attending Penn State Department of Statistics, which hosted at the time multiple centers in collaborative research, such as in environmental statistics. There was a Center for Ecology and Environmental Statistics. There was the Hershey Medical School and a Center for Biostatistics. There was even a Center for Astronomy and Statistics called Astrostatistics. And through this experience and training, I appreciated how statisticians are truly central to multidisciplinary collaborations. As I finished grad school, I took time and a lot of time to explore the job market. It's hard sometimes to find that right fit. And I wanted to find a job which would align with my passion for doing good. Thus, after graduate school, I joined RAND to work on health policy and population research, and that is where I am today. So to each of you, I say, trust your journey and it'll take you there. There are so many factors that influence my journey, and I've just highlighted some of them here. I want to highlight, especially in a professional setting, the role of mentors because they were highly valuable to my journey. Quality mentoring can help an individual with both personal and professional growth. And as I go through my talk today, I'll mention a few such mentors in my life. Now I want to return to the topic of my talk and explain how statistical science or data science is essential to evidence-based public policy and sound science, and how statisticians need to go beyond their traditional domain of data and analysis to become true collaborators in a research undertaking. So let's start with the basics. I know I've mentioned public policy a few times, but what is public policy? Public policy is what happens when governments confront an issue. Policymakers and stakeholders, and this is policymakers at every level, local, state, or federal, they need to define the issue or issues and lay out a course of action. Policymaking is not neat and tidy. It's an ongoing process in which policies are continually reassessed and revised. Some things may work, some things may need to be adapted, some things may have to be completely changed or abandoned and find a new solution. This is what I think makes statistics so valuable to public policy. Among other contributions, it is especially valuable to the process of monitoring and evaluation. There are so many areas of application for public policy, such as reducing drug overdose mortality or opioid use and overuse, improving nutrition and health, increasing school attendance rates in education, for example, particularly after COVID, optimizing readiness for Army, governance of AI, and threats of AI to national security. So there is this term called evidence-based policy. So what is that? Evidence-based policy is the science of applying rigorous, robust research methods to build credible, honest, trustworthy evidence about what works. Evidence is then used to invest private and public resources effectively. Also, policies need to be periodically reassessed and revised. Some things that work once or twice may not work in the future. And statistics is a perfect fit for sound public policy. People kind of take this concept for granted now, at least in the US, but it wasn't always that way. The first examples of EBP, or evidence-based policy, are in the 1930s, with few randomized controlled trials being implemented between 1930s and 50s in social and economic policy. And then there are some early examples of successful application of ABP in social policy which stem from the 1970s, such as the first experiments on health insurance in the US and thinking about what works in the context of health policy and healthcare. I believe we as statisticians and data scientists are well qualified to uphold the 3 R's, that is reliable, trustworthy, replicable findings, rigor, methodological soundness, adherence to sound standards, and robustness in all of collaborative science. Now, coming back to public policy, it is multidisciplinary and calls for collaborative research because the issues at hand, the public policy issues, are complex and multidimensional. Is my video not working? Oh, thank you. Statisticians are the right kind of expert to be a core team member. SPP focuses clearly on a specific policy area or problem, and statistics is applicable to many areas and can be adapted as necessary. Producing reliable, objective information is what statistics is all about. And statisticians are trained to think about assumptions that are driving the research and to explore how findings may be sensitive to the assumptions and what happens if we change assumptions. And this is called robustness a lot of times, right? Thinking about whether the findings are robust. Statisticians are trained to select the most appropriate methods for analysis at hand, adapt ones that exist or develop new ones as needed. And this is where we bring in rigor to the studies. For example, the statistics group that I'm part of has made enormous contributions to the field by developing new approaches when existing methods could not address the issue. Specific example is an approach developed to estimate racial and ethnic information about patients in healthcare settings when self-identified reliable information is unavailable. Such methods that have been developed can catalyze efforts to improve healthcare algorithms and empower clinicians to reduce bias in the way they practice. And an extremely important contribution that's on the far right of this flowchart that is often overlooked, because statisticians have helped to inform choices about models and methods in a research endeavor, they are well placed to help with communications and to guide correct interpretation. I think this is an area we can do more in. This is an area that we need to be more visible, which is in statistical and science communication. In public policy and across all areas of our work, we also need to be thinking, how can we maximize our impact? And this meaning of impact goes beyond a journal's impact factor. It's about making a real difference in real people's lives. Sorry. Can't get this to move. Okay, sorry, took a second. I've described the way in which statistics is an essential piece in the foundation for sound public policy. Stat collaboration is the sweet spot between the traditional domains of our field, which is data and analysis, and a policy researcher who is an expert on content, that's substantive content. Stat collaboration, I'd argue, is a little bit different from traditional consulting, in which a statistician gives professional advice. A consultant's involvement with a project may be a little bit limited, and their interaction with other project members tends to be intermittent and limited to technical issues only. In contrast, a statistician who's collaborating is a core member of the project team. So this is, I think, an approach that is needed for statistics to have the most impact. Let me give you an example of an ongoing RAND study in which statistics was an essential core element, making the study possible and helping to shape dissemination of the findings. Here is a bit of context. The US is a nation with high rates of obesity and overweight status. 7 in 10 adults in the US have a weight status classified as being in the overweight or obese category. Obesity is a health concern or a public health concern because it negatively affects almost all of the body systems, mental and physical, and it's also associated with chronic disease. Despite best of efforts, individual level prevention has not always been successful. It has not had much success. And increasing evidence suggested that the neighborhood environment, the neighborhood food environment, influenced diet and ultimately obesity. Neighborhoods where low-income racial minorities live in the US often are also found to lack access to sources of healthy and affordable food, and such a neighborhood is called a food desert. This is also a topic that's been heavily studied in the UK. Food deserts are believed to be a major cause of differences in obesity rates across the US. Some areas have higher rates, some have lower, but rarely are studies designed to causally test this hypothesis. In that, our study, or the study that I'll present, is unique. So here's a policy that was launched by the US federal government, the Healthy Food Financing Initiative. It was launched in 2010 to incentivize supermarkets to open in food deserts, and it's actually ongoing. It was renewed under the Biden administration. Such policy efforts are expensive. They can be really expensive. For example, the HFFI initially had an allocation of $400 million. Although intuitively, it made sense that incentivizing sources of healthy foods or supermarkets to open in food deserts could improve residents' diet, there was very little evidence demonstrating that this worked. So there's a lot of resource allocation in the absence of rigorous evidence. We found a unique opportunity in our RAND backyard with the HFFI Finance supermarket opening in a historic Black African American district in Pittsburgh, PA, after 35 years of lacking a supermarket. The Hill District was about to become a food oasis. At that time, there were few prior studies with limited evidence available. Also, findings were really mixed or not conclusive. Thus, when the supermarket opened in this impoverished neighborhood, not far from our RAND Pittsburgh office, it was this unique, wonderful opportunity to evaluate the causal effects of this intervention at the environment level. We applied for and won an award to answer the question, does greater access to full-service supermarkets lead to healthier diet? A rare high-priority just-in-time funding mechanism allowed us to launch an evaluation quickly. Like everywhere else in life, timing is everything. So I want to highlight a few things that our field, statistical science, contributed to the study and helped bring rigor to the study. So studies of environment-level interventions, neighborhood-level interventions are typically observational. In fact, many pragmatic trials have this challenge. Random assignment of treatment or the intervention is not even an option. It just happens. It's observational design. Statistical thinking made enormous contributions to this research endeavor. We researched alternatives to the randomized controlled trial and identified an appropriate study design that would be appropriate for this setting. In our case, it was a natural experiment design. We use many sources of secondary data, such as like the US Census Bureau's data, like the American Community Survey, and other sources from even local sort of data agencies, to actually use statistical matching methods to identify control group. Then there was a real need to have a control group to argue that whatever was going on in the intervention group was actually an artifact of the intervention. And this is often called a counterfactual in observational analysis. So statistical matching methods helped identify control group and justify the selection of the control group. We use probability sampling using a listing of every household in this area or these neighborhoods in Pittsburgh, Pennsylvania. We selected 2 main neighborhoods, one that was the intervention neighborhood made up of multiple census tracts, and then a control neighborhood that was made up of a different set of census tracts. And using a sampling frame or a full listing of all households, which was actually expensive, but we conducted probability sampling and optimized data collection to complete nearly 1,400 household surveys and multiple 24-hour dietary recalls per person to measure diet in an objective way. And we monitor non-response and bias, because that's always a concern in surveys is does study non-response or survey non-response add to bias of your findings? We use panel data on the same people, so you had to not only recruit them, but you had to retain them in the study and follow them over time, so that we could use assessments from the pre and post supermarket opening periods and compare people in the intervention neighborhood to the control neighborhood where no such intervention was going on. We analyzed and distilled the results using difference and difference methods for evidence-based policy. And we found that dietary outcomes of Hill District residents or the intervention neighborhood were not significantly different or improved compared with the control group. And null findings are tricky to message and disseminate. And an essential or critical point of this study is the study team's engagement with the community was essential in gaining trust and participation in minority neighborhoods historically underrepresented in research. So going back to this flowchart, I wanted to talk about how statistical collaboration was influential in every project stage, inception to dissemination. The point here that statistics is involved at every stage, not just brought in to figure out a technical problem. Indeed, a collaborating statistician might get involved in helping to write the proposal, since that clearly requires knowing what the problem is that you want to address and conveying to a potential funder that you know how to do that. Here, my role as statistical collaborator included formulating specific research questions and revising them based on available data and methods. So our problem, for example, was identifying the right outcomes and being able to measure them with rigor and with an approach that would justify sort of the resources spent. Identifying best available data. In this case, it was a combination of secondary and primary data. Primary data is where we went door to door, household to household, collecting data, including dietary recalls, but we also use secondary data in matching the neighborhoods and following overall neighborhood level trends like investments and change and what's happening in the background. So there are data sets that are available to measure the environment, and we were tracking environment level change over a period of time. We had to look at study design options that were rigorous yet cost-effective. And this is very much the role of a statistician, where sometimes the gold standard or the ideal design may be beyond the study's budget, and sometimes compromise is needed without fully giving up the integrity of the design or study. Being involved in the collection of primary data, analyzing it for quality as well as content, so that's part of the role of the statistician. We use difference in difference and econometrics types of approaches to be able to analyze the data, summarize it, and produce the findings. Distilling the results was important to inform evidence-based policy, which involves model specification, often adding variations or alternate models for sensitivity analysis. We had to validate that the information is trustworthy and accurate. Anticipating how policymakers may interpret results and help correct misinterpretation is also a really important step, because misinterpretation really leads to misinformation. And especially in public policy, we need to be thinking of maximizing impact. How can you have the most impact with the data at hand? And this is where an approach called community-based participatory research really helps identify the right questions that can benefit the community the most. Because ultimately, if the community is not served, if you do not change real people in their lives, then what is the point of this work? Intuitively, opening a supermarket in a food desert should improve diet, and this is why a lot of resources were spent without even having rigorous evidence. In reality, once a rigorous study was conducted, it didn't work that way. We found small changes in health behaviors, such as diet, but they were not sustained. Over time, these improvements went away. But we saw sustained improvements in other aspects of life, such as perceptions about neighborhood satisfaction and well-being, as well as perceptions about healthy food access. People had been living years and years in these neighborhoods, 35 years, feeling like they were underserved, feeling like they didn't have access to healthy foods and what they needed. Satisfaction and perceptions of healthy food access actually did change and really improved, contributing to mental health and well-being. People were feeling better about where they lived. For the success of the study, it was really important to get stakeholder input on what to ask. And by stakeholder here, I mean both community and researcher partnerships were essential. Researchers who had been working in the field of nutrition, researchers who were working in the field of public health, as well as local sort of policymakers in these neighborhoods who had spent years of their lives serving these communities. Multiple sectors had to get together to ask the right questions and be able to get to the right findings. Null findings were disappointing, but null findings are important to publish and document. A null finding is not what the broader research or policy community expected or wanted to hear, and more replication is always needed. So, as far as this study goes, providing access to resources, basic resources such as healthy food, is the right thing to do. However, the study provided evidence that it did not by itself change people's diets. So providing a lot of resources or policy dollars to bringing supermarkets to neighborhoods was not the gold sort of solution to this problem. In fact, we suggested that future multi-level interventions, a combination of neighborhood-level change with individual-level interventions to change behaviors, may be necessary to change diet or, in fact, any other health behaviors. This slide reinforces the points I made earlier about the value of evidence-based policy. Applying rigorous research methods to build credible evidence about what works. Using the evidence to focus public and private resources on effective interventions. Often, the evidence requires out-of-box solutions. In the end, we found grocery stores are not a silver bullet. The answer is much more complex, and careful statistical analysis helped to clarify the issues. This is just one example in the public health space where statistics and data science are brought to shed light on public health challenges, but this is also a perfect example of a policy problem. Pragmatic trials are complex because the real world is complex, and neighborhoods are dynamic because real people live in them. I would now like to offer a few remarks on thriving in your environment. So first, I'd like to talk about each of us and what we can do to build a thriving environment. So I believe each of us has a role to play, and each of us can actively contribute to building a thriving environment. I apologize if there are multiple references to the ASA, which is my professional society, but you could replace ASA with your society, or you could become a member. Think about the community that you're part of, and perhaps this will resonate. So first, I think it is critical to find your community. Within the American Statistical Association, you can often find your tribe by joining a section representing a scientific topic area or an area of interest. You can join a local chapter in your area. These are organized by geography, or a committee to be able to use our voice. I think all of these help us find a community that we can be part of, and I think the community sort of helps us leverage our voice or amplifies our voice. I believe in the value of mentors. It is really important to participate in mentoring activities at every level to help build the future workforce and contribute to a thriving environment. For example, small examples that can make a big difference is speaking to a classroom, speaking to high school students who are struggling to know what the future brings. Talk to them about a problem you worked on in statistics or data science and get them excited. they benefit from connecting with you. There are career fairs sometimes in your neighborhood, in your school district, or in your area. Participating in a career fair can also help you contribute towards a thriving community or environment. And find meaningful activities, and they don't always have to be in person. More and more these days, I think they can be done virtually. This conference is a perfect example that you can connect virtually to participate in meaningful activities. One little example is the ASA book club that the Committee on Women in Statistics sponsors. And this has been a very wonderful experience for many women in statistics and data science. So I urge each of you to find your community at a local scale or a national level, whatever works best for you, but both build and contribute to your community. I want to reflect again to that early point I made about the value of quality mentors in my career. Mentors have a role to play in building a thriving environment. Every environment, especially in a critical moment such as now, calls for heroes. Now, you may question whether there is such a thing as a statistics hero, but don't just take it from me. Take it from ASA President Bob Rodriguez, who had this to say: every profession has heroes. Our profession has an extraordinary number of heroes. I believe this is true because our discipline is the most unselfish of the sciences. It improves human welfare not by its own ends, but by its contributions in all fields. I want each of you to take a second just to reflect on this quote and think about your heroes. And thank you to each of you for being a hero to somebody. I want to take a second now to say, though we may not wear a cape or be a superhero, we do share certain characteristics with other superheroes. Fact is, statisticians are unselfish. They work tirelessly in the pursuit of good science in our case. And let me profile one of my statistical heroes who demonstrated that statistics is essential to evidence-based public policy and sound science, especially through the 2020 public health emergency that is COVID. I was fortunate to shadow Dr. Dion Price, the 118th president of the American Statistical Association. Dion was a leader, trailblazer, and dedicated mentor. She served as Deputy Director of the Office of Biostatistics within the U.S. Food and Drug Administration. Her leadership and extraordinary efforts to develop innovative study designs for rapid response to the 2020 pandemic were heroic. In an interview with Chance magazine, which is a statistical magazine, Dion had this to say: "What inspires me is being able to use statistics to make a difference in the lives of others. This is an honor and a joy." Like many of us, Dion went into statistics because our work can improve lives. And then I want to highlight the essential role of our profession, of our field in building a thriving environment, especially at this critical moment. I'd like to share a quote from another mentor, Dr. Sally Morton, who is the Executive Vice President of Research and Economic Development at Arizona State University. Sally is a former colleague of mine, a former ASA president, and a champion of evidence-based health policy. In fact, she did some of the early foundational work in the field which I work in now. Sally had this to say when I sat down with her to talk about the role of statistics in health policy. She said, particularly in this time of big data, evidence-based policy requires big statistics. By big statistics, I mean statisticians need to be involved early in the process of design and data collection, communicate with scientists, policymakers, and journalists, and acknowledge politics as part of the mix. This quote was especially relatable in my field of work, where sometimes politics can be part of the mix, but I think it can apply across application areas and fields. And again, if you don't identify with being a statistician, feel free to call yourself a data scientist, or feel free to insert a term that means here. But I think as methodologists, as people who can contribute to sound science, I think we have to broaden our role and influence in the field of science. By being involved in a project from inception to dissemination, statisticians can build actionable evidence using high-quality data to promote sound science. Data and statistical thinking are making enormous contributions to drive discovery and inform decisions in some current exciting areas of collaboration. And I want to highlight just the work of a few colleagues in today's talk. Here are 4 examples of impact that I'd like to highlight. So there's work going on in modeling weather and climate extremes by Dr. Bo Lee and colleagues. And this is, I think, phenomenal and evidence of our impact in current science. Cynthia Rudin and colleagues are working in the field of interpretable AI. As many of us are aware, interpretable models, interpretable learning models, interpretable AI are needed to understand science better. In the field of imaging, Dr. Moitra and colleagues have done work in the field of magnetic resonance imaging, another area of active collaboration and science that's ongoing, and statisticians are making immense contributions. And I'll mention one last field, which is finance, where Dr. Shumanta Basu and colleagues are working in learning financial networks. All of these examples of work are impressive, innovative, and they highlight the impact that we can have in each of our fields. I would now like to circle back to the 3 guiding principles that drive our field and share how I think that applies to each of us. For reliable, I suggest be reliable and accountable, follow through on commitments, be rigorous in sharing your knowledge and communicating with openness, and be robust in looking for ways to contribute and take initiative. I think this is how we adhere to the guiding principles, the 3 R's that I highlighted at the start of the talk. And finally, I wanted to end with a call to action. I believe our field, statistics and data science, us statisticians and data scientists are uniquely qualified to play a central role in multidisciplinary collaborations necessary to solve the biggest societal problems. The increased availability of data, new investments in research, and a growing public focus on results has increased the opportunity for professionals in our field to play an essential role in evidence-based decision-making, and we need to engage now. Thank you for your attention and time today. Thank you for this immense honor. And here's my email if you would like to connect.
Bonnie, we might need to backtrack. Someone asked what was the time duration of data collection and what was the duration of the project? Dr. Devcote, do you want to specify more about that?
I could chime in, Jessica. That question seems really clear, and then they can weigh in if they'd like. So I think that's a great question. It's a longitudinal design, like a pre and post. And I think the timing of your assessment depends very much on what is it that you want to measure. Sorry, Cynthia, did you have your hand raised?
I'll take the next question. Thank you.
Sure. So in our case, pragmatic trials are challenging because nothing works as you'd like. So we went into the field 2011 because the grocery or supermarket was supposed to open in 2012. We got really quick funding that was unusual, has happened in my life, in my 25-year career, only twice that you can get funding or resources so quickly. Funding is the bane of my existence. But that said, in this case, we got the funding and we went into the field in 2011 and had 9 months of data collection. There was intensive recruitment using what's called, if you're familiar with the term CBPR, community-based participatory research, that is the field interviewers we recruited, we had a field office so people knew we were legitimate, we weren't going away. Using a lot of these CBPR approaches, meaning investments in the community, we went out and collected the data, right? We did our listing. We had a partnership with the local university, University of Pittsburgh, with the local housing authorities to develop accurate listings, and we went out and did the baseline. The follow-up was supposed to be in 2013 because the grocery was going to open in 2012. But as is the case with a lot of pragmatic trials, is the grocery didn't open till November of 2013, so it was delayed. And our funding was 5 years. The NIH funding mechanism is often 5 years, so you're limited by that. That just meant that we had to collect all our data within 4 years and then go back and analyze and be able to publish it because the study was going to be over. So 2011 was baseline, 9 months from March to December. 2012, the grocery didn't open. We did a lot of tracking and retention. We touched base with our participants, sending out little postcards. The grocery opened finally 2013 November. We were back in the field 2014 to cram data collection into 9 months again. And one of the side effects is we think it's possible that the diet didn't change because there wasn't sufficient time from the opening of the grocery for people to actually begin using it. So that's one of the reasons that perhaps diet didn't change. One side note, we actually went back and applied for 5 more years of funding and did one long-term follow-up where we could better understand and study people's shopping behaviors. Did they switch? Why not? If not, did it meet sort of, their expectations? And one thing that became really clear is the grocery that had opened had not really collaborated with the community and did not meet the needs of the residents. So there was actually a disconnect between this grand and beautiful supermarket opening and what people needed. For example, produce wasn't fresh. Prices were high in a low-income neighborhood. The products were not matched. There were cultural sort of preferences. So all that to say that a lot of planning and community participation is needed. But the pre-post for the first study was exactly 3. It started in 2011 was baseline, 2014 was follow-up with the grocery opening in 2013. So there was roughly 9 months to a year between the grocery opening and when we measured people. That's probably a more complete response than you needed, but I hope that was helpful.
I will jump in with the next question, Bonnie. You mentioned the value of mentoring, and I wanted to know if you have any tips for being a better mentor or for being a better mentee. I think sometimes people are a little bit intimidated by that process, and would really value your insights on that.
Cynthia, gosh, this is such a big question, and I imagine everybody has appropriate responses. So being president of the ASA was something that came to me when I wasn't maybe ready for it. I was still in my career, getting my kids up to college. And I felt the one dimension I could really grow in is mentoring, because mentoring is one way to impact the lives of others, right? I had received this benefit, and so I could give that out. And there are 3 models of mentoring that I've found to be really effective so far, Cynthia. One is within my group. Especially with early career scientists, I like to do intermittent regular checkups or one-on-one mentoring. So especially when the advice needs to be tailored, needs to be specific, and I feel like if I can touch them early in their careers, I can perhaps have the most impact because maybe my advice will allow them to tailor their trajectory the way they need. And within the context of my company where I'm head of my group, this is really relevant because I know a lot about the organization and I can pass on some advice or some, career advice or professional development advice and to my colleagues. So one-on-one mentoring, I think, can be really effective. The challenge with one-on-one mentoring is it's not scalable. So then a second model is peer-to-peer mentoring. And this is something that ASA and I have explored, is what is called communities of practice. And communities of practice, the idea is a very flat structure where everybody has a voice. I think it has to be moderated to some effect. I'm a little worried about completely open discussions where you don't exactly know who's in the group, and so it's hard to gauge where they're coming from. So having some moderation is probably appropriate. And this peer-to-peer mentoring can be really helpful. And my understanding is if you have people from across career stages, then this exchange or transfer of knowledge can be really effective. So think of a group of about 12 to 20 people where maybe there's guidance on career change, right? Perhaps it's a community of practice around survey sampling, or it's a community of practice around nutrition studies. So this peer-to-peer mentoring, in my opinion, is more scalable and can be quite wonderful. And then the other part, I think, with mentoring is when we go to meetings and other places, I think opening up ourselves to networking and maybe doing kind of speed mentoring. I think the caucus for women in statistics is so impressive and so great at doing this, but sometimes a mentoring relationship doesn't have to be forever, right? But you can still have these touch points with people that inspire you, people that elevate, your vision of what you can do in some way, and speaking with them even at a conference can be valuable. So my advice would be is don't restrict yourself. There's never too many mentors. And it's okay for mentoring relationships to be not your forever best friend, They may be what's valuable now may not be valuable in the future. And the advice you can get from one colleague may be on publishing, another colleague perhaps can talk to you about balancing work and life, which is something I frankly have struggled with. So there can be all kinds of input that are needed to be a successful person in your environment.
Thank you for that.
So somebody in the chat said, how many mentors did you have at the time?
I have a really big network. What really helps is the fact that I'm very social and extroverted, like Jessica and Cynthia, right? But truly, if I thought of career mentoring, and remember, my career is 25 plus years now in the field of statistics and data science, there are probably 3 or 4 people that have lasted. Somebody from my graduate school who helped me with choices about what is it that I want to do, listen to me, and guided me. My thesis advisor is a mentor even to this day, right? Somebody who knows what type of work I can do, my capabilities. For example, I'm a very applied statistician. So I'm not theoretical. So if you push me into a theoretical field, I would probably fail miserably. It's not my calling. So somebody who could recognize what my strengths are, but is also aware of my weaknesses without shaming me, right, publicly. So there are people that have been influential in research, people that have been influential in career. So there's one person from my graduate school, the person that hired me into RAND. My first sort of boss or head of the group was very influential in me getting more connected to the ASA, finding my community that's health policy statistics. I have another colleague I can think of that's been an influential mentor. So I would say in terms of career mentors, there are 3 or 4 people I can think of. In terms of peer-to-peer mentoring, people that are my cohorts that kind of started with me and faced the same challenges and ups and downs in career. Maybe parenting, was taking away from work and productivity. When I struggled, they supported me. I have mentors. I have peer-to-peer mentors like that too. And I would say that's another 3 or 4. And then when I go to the conferences, I'm open to advice from anybody. So if you want to mentor me, you can walk up to me at any conference at any time. I'm open to advice and to listening.
It's lovely to talk to you. I don't even need to mentor you. But you can mentor me, feel free. Someone else said, for statisticians who worked mostly in clinical trials and epidemiology at a master's level, any tips on how they can move towards health policy projects, second master's or PhD in health policy, biostats PhD with health economics focus? That was a long question.
First, I am available to be contacted by email. My RAND publishes the emails. I am online, so feel free to ask. If this is about growing your career, this feels a little bit individualized, perhaps not applicable to everybody. There is a degree of master's in public policy. Even after I joined RAND, there was a point in my career where I was working remotely, and I had the option maybe to sit in on some public policy classes. And I thought, wow, I could be a quantitative or a methodologist, but I could also get maybe an MPP, Master's in Public Policy. Over time, I found that hands-on experience was just as valuable as sitting in a class. So the applied experience sort of served me well. I ended up not getting an MPP, but I think if you want to get into health policy, getting into a public policy program, some of them are quite econometrics based. Can be really helpful, like an MPP. My organization, RAND, does have a master's in policy, except it's national security policy, but there's also a PhD with an on-the-job training that they do. There is a public policy PhD. There are other institutions and organizations that offer it. So I'm not sure if that kind of advice is helpful. So there's certainly an option to go back to graduate school. but there's also perhaps an option to look for pathways to working in public policy. There are a few organizations that I can think of in the US that do a lot of public policy work. But yeah, thanks for the question. I'll take it as a compliment. I've been very lucky to be in this field. And please feel free to reach out individually, because I might be able to better sort of tailor my advice.
And Jessica, could you unmute and start again?
Thanks. We have another person in the chat who said, thank you. I agree that statistics and statisticians are essence in multidisciplinary collaboration. How about in AI-related work? It focuses more on computation. How is statistics positioning in the AI era?
Yeah, that's a great question. That's a really good question. So I live in the Bay Area, which is San Francisco adjacent, and there are many statisticians that are actually working in AI-based institutions. I'm inspired by their ability to get into a very computational field. But there are people who do statistical computation, and I think that the field of AI itself has exploded, right? And there has been a real progression towards quick implementation. But it's not unlike public policy if you think of it, or if I think of it, your question's making me reflect, where there's a lot more need probably for controlled, designed experiments, right? Thinking about bias in the samples and representation, thinking about robustness, thinking about cross-validation, thinking about uncertainty. Measures of uncertainty it's something that we can bring. So if you think of it, there are many principles of statistical science that apply to the field of AI. Have they been implemented systematically? My understanding is not uniformly, because there has been such a push based on investment to implementation. That cycle can be so rapid fire that I think more involvement by statistical and data scientists to bring rigor into the thinking is needed. Computer science has really made some massive sort of innovation and massive leaps in the field. But think of some of the bad press that AI systems have received, right? With chatbots having hateful messages or getting advice that's erroneous. It kind of tells you that there are biases in certain algorithms, for example. So principles of elements of statistical thinking are needed. Are we actively involved? I don't know how many in our field are. I know some colleagues, and I do engage with them individually, like in the Bay Area, for example, as I mentioned, there are technology companies and there are statisticians and data scientists that are working. But I do think there needs to be greater engagement by our field and greater representation, frankly.
This is such a hot topic and so hard to wrap our head around. Someone in the Q&A said, based on your experience, do you have a sense of the red flags which make communities of practice dysfunctional?
I don't, unfortunately. I don't know if anyone else in the room has advice, because yeah, I really don't know. I collaborated or consulted with a statistician who actually has done some of their work on communities of practice. It's not something that we've implemented within the ASA. The ASA right now is working on more like a one-on-one pairwise matching model. So step back for a second. The short answer is no. I would be lying if I said I have a clear understanding of where these communities of practice. If anyone has advice, I'm always willing to hear, because it has seemed like it could be really promising for our field, but the implementation has stymied me a little bit and made me a little nervous. There are people or other organizations, a few, I think, maybe outside statistics, that have implemented this. The ASA currently is looking at more one-on-one matching, mentor matching. They are working on a model, especially from early career statisticians and data scientists. There's a huge request for mentoring. That's one of the universal needs for more mentoring. There is quite a bit of ongoing mentoring, like the caucus does it. There's a diversity mentoring program. There are other sections and chapters within the ASA that have their own mentoring. So the point being, I'm trying to be fair, because there are sub-communities within ASA that do mentoring, but there hasn't been a uniform ASA-wide mentoring program. But the one-to-one mentoring is what is in the works right now. But the communities of practice, especially if we have the right, one of the challenges seem to be technology, actually, that the current technology we had deployed across the organization, across our members, was not so good. So that's one place where we've been focusing on, but I imagine in terms of the interactions, there are many other considerations that I'm not aware of.
Elizabeth, this is a good question. She said, how do you decide what professional opportunities to say yes or no to as they come up at this point in your career?
Who asked this question? Was it Umut?
Elizabeth Eisenhower.
Oh, that's a great, hi, Elizabeth. It's so nice to not see you, but hear from you. It's really difficult, it's really difficult to say no. It's actually a skill. So I'm a people pleaser. It's easier for me to say yes than no, but I think at the same time, it's not just that I want to please people. I enjoy working with people. So your nature or personality encourages you, but at the same time, there is a work-life balance. There are some strategies. I was on a panel on this, so there are 3 strategies I've heard of. One is to keep a list of what you say yes to, but at the same time, keep growing the list you say no to. Evaluate each one. And I just don't mean in like personal benefit, but kind of like, where is it that I can be most helpful? There are topics that others are perhaps equally likely to be good at. So I could just pass on the opportunity, right? I could think of creating opportunity for a colleague who may not have the network that I do. So that's one thing, is to say your yeses, but say your no's, right? And balance them. Saying no is actually a skill, and I feel I can use psychology to try to better build that muscle or skill set. I think we can all work on different skills, and I think as a woman in society, be it in family, be it in my workplace, we are more drawn to service, but I think balancing professional and professional commitments with service commitments is really important. The other part I heard a wonderful colleague on that panel talk about is they actually have almost like a tribal council where they might have 2 colleagues who they bounce ideas up before they say yes or no, because the idea being, if your instinct is to always say yes, and that ultimately leads to burnout, that doesn't benefit anybody. I think you can contribute to a thriving environment when there's balance. And I think we each need some balance in our lives. Some people have more capacity, some people don't. So that's fair. But before they commit to it, what they mentioned is they have a couple of these advisors or like a tribal council where they bounce off ideas, and that kind of helps them gauge the situation. And when they say yes, that's really the right answer for them. And when they say no, that's been a thoughtful answer too. And you can write with regrets and often pass on the opportunity to somebody else. Anything else on that, Jessica?
No, nothing's come up. I actually asked one of my friends the other day if she wanted to be on my no committee. So I said, I need one of those. I need support for
That's
that.
exactly the phrase, Jessica, is a no committee, right? Somebody who kind of empowers you, because saying no is really hard, but saying no is really important. And some skills, even for safety, you have to just say no, or for personal boundaries, but professionally too, it's a skill set I think most women statisticians and data scientists need to be working on, because I think we do a lot of service. And I'm not saying that's a bad thing, but I think we have to balance our personal and professional interest versus service.
I think it's important to, pay attention to if you are maintaining balance while doing that.
Yeah.
I'm to the point now where I'm like, if it doesn't bring me joy, I don't want to be a part of it. So
That's a really fair point. And working with friends is always a joy, right, Jessica? Like, there are people you want to partner with, collaborate with. It's a chance to connect and contribute to doing good. So that's really important and gives us joy.
For sure. I guess our time is up. Just kidding. We have like 1 minute. Thank you so much for being a keynote speaker and our first keynote speaker. We really appreciate you. It was fantastic. to have you here with us today.
I just want to close out saying thank you for this honor and opportunity. I really enjoyed being able to share some thoughts, and please feel free to connect with me on LinkedIn or by email, and I promise to get back to you, if not right away, pretty soon. Have a really good rest of the evening. Thanks tons.
Thank you.